I want to talk to you about ingrown nails and what can be done about them. To make it more family friendly, I'm going to be using larger than life model toes to help me explain the different treatments. An ingrown nail can be an extremely painful experience. Essentially, a splinter of nail pierces the skin and continually grows in, causing redness, heat, inflammation, and of course pain. In the most severe cases, infection may also be present. The way to deal with an ingrown nail depends on the severity of the condition, but the treatment offered falls broadly into three categories. The true ingrown nail, as I just mentioned, requiring surgery so that it doesn't grow back, and we'll come to that in a minute or two. The pre-ingrown nail that can be managed with careful cutting and advice, and the convex nail that presses into the skin grooves either side of the nail that needs bracing, much like a dental brace is used to help straighten teeth. Let's consider this one first, and I'll explain what can be done about it. The convex nail is often higher than normal and can press on the inside of your footwear. Pressure builds up in one or either groove that will over time be uncomfortable. Removing the original cause of the convex nail is of paramount importance, and your practitioner will explain this in more detail. Once that's taken care of, the nail can be prepared to accept a thin acrylic brace that in its quiescent state just wants to be flat like this plastic ruler. Once glued to the top of the nail, it starts working its magic straight away. Applying it further up the nail towards the free end gives the maximum pull, but applying it about halfway down gives a longer lasting treatment. One brace application might be all that is required to get you over that problem. However, multiple applications may also be necessary to ensure that you remain pain-free. The second condition I want to talk about is the pre-ingrown nail. It might be painful, but it's manageable. You've had it for weeks, months, or even years, but now it's getting on your nerves. With these nails, it's just a case of patient advice with the following treatment. The nail is cleaned. The point at which the ingrown part of the nail is digging in is identified. A slender cut is made from the free end of nail to just past that point, and the offending piece of nail removed. Because we are using very fine instruments to cut past the ingrown area, there should be no pain. The corner that is left will be gently filed round to aid forward growth, which in about 8 weeks will be near the top, at which time your practitioner's advice should be sought. Now for the true ingrown nail. This will be a persistent offender, one where all other treatments have failed. In these cases, surgical intervention is often your only choice, and I'm now going to explain a very aesthetically pleasing way of removing part of the nail and not allowing it to grow back. The toe is cleaned and numbed. A couple of scratches, that's all. The anaesthetic will last well after the procedure is complete. A tourniquet is applied. The nail plate is loosened from the nail bed just in the area to be removed. A cut is made in the nail plate parallel to the side of the toe. The cut is continued under the cuticle with a fine blade, so we don't need to cut the cuticle. The now loose nail section is then rotated inwards towards the centre of the toe. That's most of the procedure done. A chemical is now added to the groove vacated by the nail to prevent regrowth. You'll attend for 1 or 2 redressing appointments as necessary. This groove will eventually close, leaving a nice, neat nail to skin junction, and you totally pain-free.